For more on this, let's bring in Mel Bower, Chief Communications and Marketing Officer at Shriners Children's Hospital. That's where that little girl who perished in the crash was receiving treatment. Mel, I know that, under patient privacy laws, there's a lot you cannot say, but can you tell us the age of this young patient?
She had been with us here in Philadelphia for about 4 months, and of course then had formed some very deep bonds, with people throughout the hospital during her care.
Because we didn't have your microphone open there at the beginning of your statement, could you just repeat, are you able to say how old she is?
Sure. Unfortunately, due to patient privacy, I'm not able to confirm the age, but to say we treat pediatric patients only.
Okay. So yeah, 4 months of treatment. Yeah, she must have been very well known to many of the nurses there, and it's got to be absolutely heartbreaking that you save a life and then all of a sudden that life is snuffed out.
It truly is, and it's more than just the nurses. She left an impact on members of our staff, as well as other patients who were staying here at the hospital during her time. And so it's just a loss that's very deeply felt here today at Shriners Children's. And you can feel that throughout the building, no matter what staffer we talk to or a care provider. It's something that everyone here on the Shriners team is just really wrestling with and feeling very deeply.
We know that her mother perished with her in the crash. Was her mother there for the entire 4 months, or did she fly in fairly recently to escort her daughter home?
My understanding is that her mother was with her the entire time. And so she also had formed some very deep relationships and bonds with people here on the staff, as well as other patients and their families.
And this was a no-fee treatment program from Shriners, correct? You don't charge patients for the care that they receive.
So Shriners Children's treats all patients without a regard for what their family might be able to pay or their insurance status. That's correct.
All right. So again, the air ambulance that was to take her home, that's unaffiliated with Shriners. That was a separate operation and paid for separately, it's my understanding, again, by donated funds.
So we are not obviously in the transport business, we are in the patient care business. And so if there's a patient that needs to be transported, we have a variety of resources at our disposal that allow us to make the best choice for that child. We do a lot of international work, international outreach. We treat children from over 170 countries. And so these types of transports are a big part of the work that we do. But of course, a tragedy like this is just unthinkable and not something that's ever happened to us in our history, and something that's just very difficult to even contemplate, given its severity and the gravity of it.
Being that you are in the medical business, I mean, I'm frankly stunned that there was only one fatality on the ground, at least that we know of so far. There could be others forthcoming. But given the size of the fireball and the crowded intersection that plane went down into, it's a miracle that there weren't more people killed.
It really is. The situation here in Philadelphia is still, it's just evolving moment to moment. And so there's still quite a bit that we're learning here on the ground, but certainly it's just an unspeakable tragedy and unthinkable that it's happened. And I think everyone here on the ground in Philadelphia is still trying to just wrap their arms around understanding it, because it's just so unbelievable.
Are you having, any kind of counseling sessions for other patients or maybe medical staff who knew this young patient?
Yes, we have made counseling services available both for patients as well as members of our staff. And so that will continue to be a resource that's made available not only today, but in the coming days, keeping in mind how difficult and unique the grief process can be. We will continue to support our patients and our families and our staff as we go forward.
I know it's a terrible time for all of them, and we wish you well as you try to get through this. Mel Bower, the Chief Communications and Marketing Officer at Shriners Children's Hospital in Philadelphia. Mel, thanks.
Thank you.